The, the genesis of this act it's a continuation of a trend toward more transparency.
But I think we have to ask ourselves as a physician, I'm an orthopedic surgeon, as we mentioned, why did Congress do this? And they did it because consumerism needs to be part of the healthcare conversation.
So a lot of folks, they have said, well, the No Surprises Act doesn't really apply to me. I'm not worried about that. Well, it does apply. Upon request by the patient, you've got to give them an idea of what the services are going to cost well before you provide them. The GFE needs to include what services are being provided, where they're being provided, and an estimate. You should not estimate low for reasons we'll talk about in a second.
This is the government's numbers, not mine. 1.3 hours per GFE is what they calculate it's going to take to generate these things.
So you've got to have some public noticing on your website and in your practice of the good faith estimate requirement, and frankly of the No Surprises Act as well. But we know this, you could be liable for a civil monetary penalty up to $10,000, and the public relations impact could be a lot more destructive than $10,000 fine.
This is federal law and you need to comply, just like HIPAA, because the potential penalties are up to $10,000 fine per incident.
We know that there are people who are pushing hard the need for transparency, and they're going to be testing physicians on whether or not they're in compliance.
Right, this is what patients want. They want consumerism, they want transparency, they want value. Most practice, including my own, was turning a lot of cash pay business away. And whether you believe you're doing that or not in your office, I could probably prove that you are, right? And we've done studies. So we have a 5-year history of helping practices really retail their services by helping them bundle their services, helping them price their services. And we have a software platform that helps them shop. By offering transparently priced bundled care, you increase patient satisfaction, increase your staff satisfaction. Right, so we tasked our team to build out a GFE engine, and we actually released that in early January 22 and generated close to 50 good faith estimates the first month for our clients. What is this GFE engine I'm talking about? Really, we created a turnkey solution for compliance. These are some of the things the government requires, right? So I'm going to talk about the government requirements, show you what this looks like. So you need the name of the practice, NPI number of the provider, location. You need clear language describing what's included. And then CMS wants some disclaimers on there. These need to be consistent, right? They need to include all this information the government's asking for. So how do we able to accomplish this? When the patient clicks on that on your website, basically they can request a good faith estimate, and it turns really a long process into 90 seconds or so on the phone with the patient, if not less.